The abrupt cancellation and postponement of critical vaccine advisory meetings at the CDC and FDA have sparked deep concerns over potential delays in vaccine distribution, a lack of transparency in decision-making, and a growing vulnerability to preventable diseases. Under the leadership of U.S. Health and Human Services Secretary Robert F. Kennedy Jr., the disruptions to these long-planned meetings have led to mounting uncertainty over the approval and availability of vaccines, including those for the flu, RSV, meningococcal disease, and mpox. The absence of expert discussions and public deliberations threatens not only the efficiency of vaccine production, but also the public's trust in the regulatory process at a time when vaccine hesitancy is already fueling outbreaks of dangerous diseases. The February meeting of the CDC's Advisory Committee on Immunization Practices, ACIP, which was meant to assess key vaccines and make recommendations for their use, was postponed without a clear plan for rescheduling. This disruption is particularly troubling given the resurgence of meningococcal disease and the ongoing fight against seasonal flu, both of which require timely decision-making to ensure effective immunization efforts. Even more concerning is the cancellation of the FDA's March 13th meeting of its Vaccines and Related Biological Products Advisory Committee, VRBAC, which was supposed to determine the composition of the upcoming flu vaccines. Without this meeting, manufacturers may lack the necessary guidance to produce effective flu shots, potentially delaying their availability and leaving millions unprotected against a virus that hospitalizes and kills thousands each year. The implications of these disruptions go beyond logistical setbacks. The postponements and cancellations create a dangerous precedent of sidelining scientific expertise in favor of political maneuvering. Vaccine approval and distribution rely on careful, evidence-based deliberations that involve independent specialists with years of experience in immunology, epidemiology, and public health. By eliminating or delaying these critical discussions, the regulatory process loses its transparency, increasing the risk of misinformation, reduced public confidence, and avoidable outbreaks of vaccine-preventable diseases. The longer these disruptions persist, the greater the likelihood that key vaccines will be unavailable or improperly distributed, directly endangering public health. Robert F. Kennedy Jr. has long been a controversial figure in vaccine policy, frequently casting doubt on the safety and efficacy of immunizations despite overwhelming scientific consensus. Though he insists he is not anti-vaccine, his repeated misrepresentations of vaccine advisory processes and his history of financially benefiting from lawsuits against vaccine manufacturers raise serious ethical concerns. His claim that 97% of ACIP members have conflicts of interest has been debunked, yet he continues to promote the idea that vaccine regulatory bodies are compromised. This narrative fuels public distrust, which in turn contributes to declining vaccination rates and the resurgence of diseases like measles, an entirely preventable illness that is now making a disturbing comeback in the U.S. due to vaccine hesitancy. The absence of a clear timeline for rescheduling these meetings adds another layer of uncertainty. The FDA has stated that it will still provide recommendations to vaccine manufacturers for the 2025-26 flu season, but without a public advisory meeting, it is unclear how those decisions will be made or whether they will be subjected to the usual rigorous review. Typically, flu vaccine strains are selected based on expert recommendations from the World Health Organization's Global Influenza Surveillance and Response System, which analyzes circulating flu viruses to predict the most effective vaccine composition. While the U.S. participated in the WHO's recent deliberations, the decision-making process within the FDA now lacks the public discussion that has historically been a cornerstone of vaccine policy. Experts in the medical and public health communities are voicing serious concerns about the consequences of these disruptions. Dr. Tina Tan, president of the Infectious Diseases Society of America, has warned that delays in vaccine strain selection could cost lives. Without clear FDA recommendations, flu vaccine manufacturers could face uncertainty about which strains to include in their formulations, potentially leading to shortages or ineffective vaccines. Meanwhile, Dr. William Moss of Johns Hopkins University has pointed out that removing expert advisory committees from the decision-making process deprives the public of crucial insights into vaccine development and safety. The lack of transparency could erode trust in vaccines at a time when misinformation is already rampant. The dangers of delaying vaccine approvals and recommendations cannot be overstated. Flu remains a major public health threat, with severe seasons overwhelming hospitals and leading to thousands of preventable deaths. Measles, which was once nearly eradicated in the U.S., is resurging due to falling vaccination rates. Meningococcal disease, a potentially deadly bacterial infection, requires proactive vaccination efforts to prevent outbreaks. Any disruption in vaccine availability or public confidence will have real, measurable consequences.